Hi, I'm Dr. Trent Ryan, owner and CEO of Kennedy Health, Pain Relief and Wellness in Delaware, and partner with Regen America Centers for Regenerative Medicine. I'm a chiropractic neurologist. I spent many years training in regenerative medicine, continuing education, and our clinics have some of the best medical doctors trained in performing interventional pain and regenerative medicine, and medical providers that also perform these. I'm very passionate about regenerative medicine. I'm so happy you're listening to this and watching this. I've seen thousands of patients do much better and get out of pain with regenerative medicine and stem cell work. I'm not going to share my story as I go through this, but one of the reasons I get so passionate is because I've done a lot for myself and my family. So without further ado, let's dive right in and educate you on regenerative medicine. Usually there's two reasons to watch this. Either just excited to learn about stem cells, or you have something you're hoping stem cells can help you with. Today's a chance of a new life. Today's a day to be excited because you can finally have a chance to feel better, end the never-ending pain cycle, and get your life back. Today is your opportunity to change your life. Whether it be getting back to playing golf, or just walking down steps, or getting up in the morning without being in a lot of pain, or not being able to sleep through the night. Get your life back. So my purpose ever since I've been in practice, since the mid-90s, is get people out of pain, get people well, regain your activities of life, maximize your health the rest of your life. It's been my personal mission, and ever since we've had the ability to do regenerative medicine and stem cell work, that's the main thing we want to do. All the other treatments we're going to talk about, what are those other treatments you've had? You've had all these treatments. The old way of thinking, you have to change your minds to regenerative therapy because we've been educated for most of our lives in something called degenerative therapies, that we call this degenerative therapies, such as drugs, surgery, medications. Do those stop the condition? Well, rarely they stop the condition. Occasionally they do, but you got to keep taking them and keep taking them. They're a patch, right? They're a symptom patch usually. Well, we have to change our mind completely. It's kind of like a Star Trek thing. We're like, wait a minute. This is futuristic. We got to get your mind out of the past and put it into the future. Stem cell therapy is regenerative therapy. We're not going to show you how to mask your symptoms because regenerative medicine has the potential to help the underlying cause of the problem. Studies show that they can get to the root of it and even assist in regenerating it. Stem cells are called the body's master cells because they develop into all other cells. They actually become new cells. They can turn to the cartilage in your knee, in your shoulder, the discs in your back, the nerves, the blood vessels, ligaments, tendons. Whatever it needs to turn into, it turns into. Brain cells, blood cells, organ cells. The main talk today is about your pain conditions. Current research shows your body can regenerate. Therefore, they have the potential to repair and help to regenerate the joints of your body. Regenerative medicine and stem cell therapy is revolutionary. Current research shows that your body can regenerate. Therefore, they have the potential to repair and help to regenerate the joints of your body. And not just joints of your body, a lot of other tissues, nerves, tendons, ligaments. They're the healing cells of your body. Why are stem cells so important? Because once your body starts to degenerate, that process won't stop unless we regenerate it. So really, there is no other choice in my mind, and you're going to see in this presentation why your alternative is only stem cell treatment or regenerative therapy. For the first time in our lives, we can regenerate, thank goodness. Stem cell therapy can potentially regenerate every area in your body. So let's talk about you. Do you have low back pain? Do you have mid-back pain? Do you have neck pain? Neuropathy, burning in your feet, tingling, numbness in your feet or hands, degenerative disc disease. You might not know if you have degenerative disc disease or not, but usually you do. It's one of the reasons why you're shrinking. And you can multiply all those discs in your back. They start to degenerate, and a couple might be really bad, and those are usually the areas that are painful, and they go hand in hand with arthritis. Do you have neck pain? Do you have other areas of arthritis, like knees? Knees are the most common thing that's treated. Do you have bad hips, arthritic hips, painful hips, shoulders, elbows, hands, feet, ankles? If you do, it's not okay to live like this. And there's something else you can do about it, thank goodness. Let's talk about some arthritis progression. You might be familiar with this look. If any doctor has ever went over your x-rays with you, you'll see the inside of this joint over here has decreased. It's asymmetrical, meaning one side is not the same space between the bones as the other side. The cartilage softens, loses ability to absorb impact. Of course, you have the joint space loss there. Progression of it as it gets worse, and sometimes you're not even in pain at this level, phase 1 or phase 2. Sometimes you don't even know about it. We've done x-rays on people who don't even have pain in certain joints, and they have arthritis there. Well, phase 2, large section of cartilage wear away. The joint begins to lose its normal shape as the cartilage breaks down. Phase 3 gets a lot worse. Oftentimes you're in pain at this level. Bony growths or spurs called osteophytes form on the edges of the joint. This spur coming out to one side of the joint here. See extra whitening called sclerosis, and you get these angulations sometimes that are so bad, whether the hands or the knees or any joint really that we're talking about here. I've had people actually come in looking like they've been riding horses their whole life. I've done hundreds of these lectures throughout different areas of my area, tri-state area, as well as in the United States. And I've had so many people come up, even at my lectures, showing me their knees. I had one lady stand up and go, look, I have been riding horses my whole life, and her legs are like this, and very arthritic, of course. Let's show you some hip degeneration. And you're going to see how similar this is with other joints. Narrowing of the joint space happens. See the normal joint space and the joint space start narrowing. You know, there's nearly bone on bone at the top there. You see hardly any space. See that arrow. Shoulder, same progression, normal shoulder. Nice space between the joints, and you see it sandwiched together. And you can also see a spur at the bottom there. Hardly any space there. Very painful joint at that time. Spine. Look at the normal spine. You can see the difference. Even an untrained eye can see what's going on at the bottom of this. Look at the space between those bones. That's the disc degeneration. The spurs looks like a beak coming out the front of that. And the back side, you can see how the discs are just sandwiched together and actually pushing into those holes where the nerves come out. Well, what's that called? Stenosis. And this is the same type of arthritis that's happening in your knees and shoulders, but it's happening in your spine. It's irritating nerves. It's not just a disc herniation, it's a piece of it. The degenerative disc bulges, there's all these different terminology we use on basically an arthritic spine with disc problems and joint problems and spurs. It all leads to one thing called stenosis, and we see it all day, every day. And we are one of the few clinics that can treat the spine appropriately, utilizing fluoroscopy, where we're actually going to go down into those discs, into those spaces, the transforaminal spaces, the epidural spaces, and all the facet joints, and we just soak the area. I have a slide coming up that's an MRI cut through here where we're going to show you how we treat the spine. And once you learn about this, you realize you wouldn't do anything else except regenerative medicine to do this. When you can put it in there and it takes one treatment. I have a slide coming up on one of the ladies, many ladies that we've taken out of walkers by injecting every level of the spine that needs it. We might have to come all the way up if it's that bad. If all those two levels were that way all the way up her spine, you do it all at the same time. And you get up and walk out. So how long have you had your main condition? Is your knees, your back, the worst area? How long? A lot of my lectures on that, people are talking about a couple years, maybe 6 months, or maybe 20 or 30 years. How often? Do you get it daily? Do you get it once a week? Well, a lot of people are getting it a couple times a week at least, if not every day. And dealing with levels of pain, they're usually around 6 to 8, 9 or 10. And I can't even fathom that level of pain. I don't like a 1 or a 2 for 20 minutes. Dealing with that level of pain, I just sit there and go, I think about it, I go, well, how are you living with this? How frustrated do you get with this? Do you get angry at times? It's not right. It's not good. You just rely on your temporary shots and you got to keep coming back, and that's actually what we're talking about. That makes it worse coming up. What have you tried? Pain medications, steroid injections, maybe soup parts or Synvisc or Orthovisc or whatever, chicken fat, whatever, hyaluronin that you want to use in there. And we do all those things too, but we don't want to do them anymore really. We need to do regenerative medicine. The other stuff is very temporary. We're going to talk about this some more. How discouraging is this? Do you actually get depressed at times? Do you get angry at times? when this is happening. Go back. Maybe it's 2 years, maybe it's 5 years, maybe it's 20 years. Remember when you didn't have this pain. How good was life? What were you doing? How good the grass smelled when you walked outside? How fun was it to get down to the round of golf and go have fun with your friends and not to worry about, oh my God, I can't even go anywhere. Or worry the next 3 days or misery because I just got through this round of golf. Maybe you can't even walk your dog or stand and make a meal, Thanksgiving meal without sitting down. I'll sit here at the table while everybody else does work. Or can't you just walk down steps, let alone get out of pain? You know, if you think back how great things were and how bad things are right now, think about that. Envision how great things were, how good things are right now, or bad things are right now. Isn't it awful? And think about the future. If this isn't done, we don't change this. You don't even want to think that. If it's this bad now, and you're sitting here with 6, 7, or 8s, or 9s, let alone a 3 or 4. I don't even like a 3 or 4. It's getting worse. And this is the treatment to do it. Thank goodness we have this ability now. Has a doctor ever told you to learn to live with it? It's your age. It's the weather. Then nothing can be done. Well, thank goodness something can be done now. You're not just getting older. All these conditions can affect people of every age group. Oftentimes, traumas early in your life create this. Your genetic makeup can affect this. We've treated people 18, 19 years old with these same type of conditions. Age is not the main reason you get this. However, your chance of getting the problem when you get older is higher. I've seen people 90 years old in pretty good shape. Of course, they've been getting certain treatment throughout their life that's helped that. Not the natural surgeries and pharmaceuticals that we all reach for here. Your condition is robbing your quality of life and keeping you in pain. Our purpose here is to help you, not just lecture. I'm here to change your life. And one of the most exciting things I do when I go into one of our clinics, you know, patients come in and they get they're crying and they say to me, you know, thank you so much. Thanks for the presentation I got from you or how I contacted you. And the spouse comes in practically crying, going, I got my wife back or I got my husband back. We're going on a trip. Where are they going to go before this? Go sit in an airport if they even made it through an airport because they're in misery. Do you want to travel? Do you want to get out and live your life as you should? Life is too short. Get out of pain. Let me ask you a simple question. If you get rid of your problem once and for all, would you? Well, you know the answer to that. Well, I hope you agree you got to get rid of this. Next step, how do you think? What's the mindset? Do you take better care of your car? Symptoms are a warning sign something is wrong. And using this car analogy, as using these symptoms as the gauges on your car, and symptoms are a warning sign something's wrong, whether it be a pain or ache, or you got sick, or you got a headache, or whatever it might be. Symptoms are a warning sign something's wrong. It's how your body talks to you is through symptoms. We don't have warning signs like the gauges in the car. But what do we do with your current treatments you're using? It's like taking a piece of black tape and putting it over top of the light. That's what you're doing. You keep patching up, and you keep driving, you keep pushing yourself. And you're breaking down, you're ceasing up, you're not moving just like the car would. But do you take your car in for the right service? Yeah, I often do. But do you take your body in for the right service? You might think you're doing that by the current treatments you're getting, but it's not stopping the process. There's no such thing as a normal symptom. You check your car, your body deserves a better care than your car, your house, and other belongings. Even if it costs money, you'll fix your car, but will you fix your body, right? That doesn't make any sense. All this physical stuff can be replaced. We got one of these. Take care of this. What are your options? Do nothing different? Continue to suffer with pain, limitation, loss of function? More medication, cortisone, steroids, and other drugs only provide temporary pain relief. They do nothing to actually fix the cause of your problem. Surgery, painful, expensive, and often results in the need for additional surgeries. You might not know that there are studies out there that show an alarmingly high rate of deaths from surgeries. I just saw one in 28, and I saw a few more, a lot worse than that. Let's get real. Do you think that if you continue to use the usual old medical methods, that your health will become better? Regenerative medicine, turn back the clock. Let's talk about your knees. Cost of surgery. Well, we talked about death already. Pain, 3 to 6 months of healing and rehabilitation time. And they only really last for 10 to 12 years if you want to use it. If you're a little lazy, you're not going to get the range of motion back. No guaranteed result. High percentage of failure and complications. 50% or more will need additional surgery. 50% or more. So it's worse than flipping a coin if you're going to have success. And our clinics do all kinds of care. And we see so many patients that come in after knee replacements asking, can we do stem cell work? What do you think? No. It's not biologic anymore. You're bionic. And how many people do you think die of this? I have a slide coming up talking about the deaths, but I want to talk about it here too. I talked about death rates of surgery, but specifically knees, it's 1 in 400. Write the Journal of Orthopedic Medicine. 1 in 400. I've done so many of these lectures. So many people have put their hand up and go, that's why I'm here. My husband died of it, or my wife died of it. They start crying at that time. I feel so bad for them because they didn't know the risks. They weren't educated in the risks. Now you're educated. Do you want to be one of those stats? Look at the cost, $60,000, $55,000. It keeps rising every year. How much money is taken home from that by your docs that are doing those procedures? Let alone does it pay for a lot of the wings of these hospitals that are doing this? They need that money, so there's a business shift that has to happen because stem cells are the future. There's a chance you might need this surgery. Think a lot of people are candidates. There's a chance you're not a candidate. And we'll talk about that a little bit more. What's the cost of your lost time, function, pain, and suffering? And even if you have Medicare, you may still have to pay $11,000 if you don't have a secondary. Spinal surgery, even worse. Look at that. 72% needed further surgery. Look at the price tag on these. It's a small house. Over 500,000 performed annually, 90% are unnecessary and ineffective. 90%. You believe that? Did you know that? Now that's eye-opening. And once you know how to treat the spine right, I'm going to show you another slide coming up, an MRI, you wouldn't do anything else except stem cell. This is what you got to do. You get up and walk out. One of our testimonials. Thank you, Kennedy Health Center and Regen America, Delaware, for making stem cell healing available to me. I was in pain and unable to walk normally for about 8 months because of a torn meniscus. After having my own stem cells injected into my knee, it began to heal. I'm now walking like a normal person and enjoying life again. Here's another one. My name is Sarah. For a number of years, I've been suffering with back and hip problems. In recent years, my activities and quality of life have greatly decreased due to this problem. A friend who has suffered with similar problems told me about stem cell therapy. He told me that his pain and discomfort disappeared after having stem cell therapy, which he swears by. Being one who is deathly afraid of spinal surgery, and after all the options and procedures failed, I opted to try stem cell therapy. Both my husband and I are glad I did. It's now been a few months since my procedure, and I'm feeling better with each passing day. My quality of life has greatly improved, and I'm on my way to doing the activities I once enjoyed, such as dancing and exercising. We're now looking forward to going on sightseeing trips. Shoulder surgery, similar to knees, a little cheaper. Look at the wrist. It's about 50-50, just like the knees. Large rotator cuff repairs retort rate of 57% in a series of 500 patients. Risks of surgery, bleeding problems during surgery, blood clots caused by surgery, difficulty breathing after surgery, infections after surgery, 4 in 100. I already told you about the deaths, 1 in 400 deaths following knee, let alone the stat I gave you previously, surgery deaths, 1 in 28 in worse studies. And that's not including anesthesia. Increased use of narcotics, NSAIDs, muscle relaxers, painkillers. You know about these, right? It's an epidemic of the painkillers. Vicodin, hydrocodone, Percocet, habit forming, seizures, constipation. Sometimes the constipation is so bad they have to do bowel resections. Weak breathing, unconsciousness, unusual fatigue, bleeding, bruising, decreased sex drive, awful stuff. And here's a slide that is an eye-opener for a lot of people. Non-steroidal anti-inflammatory drugs, NSAIDs, non-steroidal anti-inflammatory drugs. 10 to 20,000 deaths each year are the result of severe bleeding. And we've had patients that have come in and talked about, I can't eat right. I have ulcers in my stomach. I've been on this for years. Yeah, what are the NSAIDs? Ibuprofen, which is Motrin and Advil, Aleve, naproxen sodium, which is Aleve, Toradol's injectable version, Tramadol, Celebrex, and the list goes on and on and on. There's a lot of prescription-based ones you might not know you're on that are NSAIDs. awful also on the joints. Research came out years ago showing that it's also degenerative to cartilage in your joints. Very rough on the body, let alone the kidney disease we've seen from, the liver problems, digestive issues from this. You're really running a high risk when you're on non-steroidal anti-inflammatory drugs for a long time. They're never really meant for that long-term use. You got sick, you had a fever, you get off it, you hurt yourself temporarily, you got to get off it. People use it all the time. You're running a high risk. You're going to have problems. Cortisone injections, powerful anti-inflammatory, but very, very risky. Osteoporosis, up to 8% loss of bone in 4 months. Low dose for 1 year can cause cataracts. Elevates your blood sugar. And if it's given to somebody with blood sugar that's a little elevated, we've seen them pass out within a second. That's how powerful it is. Getting a knee injection, they're out. Suppresses your ability to fight infection. Cartilage degeneration actually promotes your problem. Makes it go up faster. Makes it degenerate faster. Your chance of having surgery much quicker with that. And you don't know you're in pain. And you degenerate more because you're doing more activity. It's blocking all the nerve impulses to your brain saying, stop doing that. Tendon rupture or weakening, a death of nearby bone. So your current treatments are actually speeding up your process with temporary relief. Not regenerative therapy, thank goodness. Okay, let's education regenerative therapy. Stem cell treatment. Mesenchymal stem cells. Mesenchymal stem cells, we're not going to talk about hematopoietic stem cells. They've been used for many, many years with leukemia and things like that, but mesenchymal stem cells are the new age here where we're actually able to use these to regenerate. First thing it does when we put it into a joint, you see that bright knee over there, is reduce inflammation. That's why some people come out of the procedure room and they're kicking their leg around going, oh my God, I'm out of pain within minutes. And when they want to jog around the office, we practically have to sit them down and say, all right, take it easy. We got a couple weeks of taking it easy. You can walk out of here, but it's a lazy couple weeks. Do what you've been doing, but you couldn't do much before. Then in 2 to 4 weeks, you can start picking it up and get back to your normal life. Not like a knee surgery where you're down for many, many months with high risk. Risk in stem cell treatment? Hardly any. We've never seen a problem with it. We've done hundreds and hundreds of these. Next thing it does is fight cell death, keeps around whatever's viable. That will replicate the cartilage or ligaments or tendons, blood vessels, whatever needs to be replicated, it takes care of it. So we're able to take stem cells and put millions of mesenchymal stem cells and fill up a joint or disc in your back, the whole area of the back that's you have a problem, or neck or wherever. We fill it up with these mesenchymal stem cells and let it do its work. How many treatments does it take? Usually 1. That's all it takes. With pain relief, often within that day or weeks, and it continues to work to a certain extent behind the scenes for 8 months to a year. And they'll self-replicate themselves. The stem cells can self-replicate themselves. The different sources of stem cells. Number 1, we're not going to talk about it anymore, embryonic stem cells. They're illegal. We can't use them. We're not going to talk about it anymore, but that's why a lot of people, and even doctors I've talked to, when they went to their PCP and said, hey, look, he said it's unethical. I mean, what are you talking about? I'd talk to the doctor and say, we're going to use our own. Or here's another source. Oh, I had no idea. What follows FDA guidelines we're going to talk about. Umbilical cord tissue. Wonderful product, has millions of mesenchymal stem cells that are donated. We have a slide on that coming up. Very safe to use. There's also placental amniotic fluid. That can be used also. There's may or may not be live stem cells in the placental amniotic fluid, but still works with all of its wonderful growth factors. So you might think, if you can get a donor, are stem cells genetic? No. You can actually provide these to other people. Neonatal can go to other people. Adult stem cells, you can use bone marrow with the FDA-approved devices. That is one of the biggest things that's being done now. We can also use adipose, which is fat. I've done all those myself. I've done the liposuction. I've been through the bone marrow work. I'm not going to share my story as I go through this, but I've had all these, and then it works wonderfully. You can go through the adipose work. I do liposuction. It takes a couple hours. It's painful. We do that. We don't do much of it anymore because of the time it takes and the manipulation that has to go through that, because FDA doesn't care for all the manipulation. It's still compliant to do, though. Bone marrow stem cells with the FDA-approved devices is the main thing, and I'm going to explain how we do the bone marrow work. So our sources, we select from the sources that you may need. What works best for you depends on a lot of other conditions that I can't go through here. We're going to talk about how we can figure that out for you, which source is the best. And you only want to go to a clinic that can do all the sources, has a selection to do the different sources, because what's going to be the best thing for you depends on many different variables. Taking the bone marrow out, we use these specialized FDA-approved devices where it slides in through the back of your pelvis, an area you can see to the right and left of your buttocks, right above the butt crack. And we pick a side, an area called a PSI, and we numb it up heavily with local anesthesia. And we take this device, smaller than my pinky, you can see it, and it just screws right in. We're in there within seconds. When I had mine done, I just felt like somebody was putting a finger on my back. I hardly felt anything. And the majority of people hardly feel anything. It's nothing like the old bone marrow biopsies of decades ago. Wonderful devices, and all of our docs and MDs that do this, they saw this device and saw the procedure for the first time, and oh my God, this is great. And it's such wonderful technology. We're actually able to take out what we need in the pelvis, and they're in there for a few minutes, pulling whatever they need out. You don't feel it when they're in there. And that device is doing manual filtration, and we're loading up syringes right in the same sterile field. We don't have to take it and process it in another sterile field, another room, which we have to do for the fat. We have all the hoods and centrifuges and all that. We don't have to use it for this. It's wonderful. And we're loading up right in that same sterile field, right with the fluoroscopy unit in the procedure room, and we're able to take that, whatever we need, out of your bone marrow, millions of mesenchymal stem cells, and go right back to where you need it. Is it in your knee, your hip? We just move the fluoroscopy unit, move it. Do we go all through your spine and do it? Do you go to your shoulder? Wherever we have to go, and we can do it all at one time. We've done people's necks, low backs, both knees, practically their whole body all at one time. Absolutely amazing technology. And all we do after we take the stem cells out, we clean you up, gauze, tape, we'll drain for 5 or 6 hours a little bit. Next day, take it off, shower, you're fine. Nobody's ever complained of pain from that area. I didn't feel any pain when I got mine done. Adult stem cells. When you're younger, you have a higher concentration of stem cells. They substantially decrease as you age. But you have them stored in your bone marrow, your fat, teeth too, but we're going to keep your teeth. So we can take them out of there and concentrate and put them where you need them. When you're younger, you have a ton of stem cells. One of the reasons why you're breaking down now. Your skin's getting thinner. You're wrinkling. Your insurance rates are through the roof because look at this graph here. The amount of stem cells you have really decreases. When you're newborn, 1 in 10,000 cells in the body is a stem cell. By age 30, it's 1 in 250,000. By age 70, it's 1 in a million. Age 80, it drops right off the cliff there. Imagine if you had all those stem cells put into a joint in your back, and it can mimic being a newborn in that area for a while and regenerating that area. That's what this is all about. The Commissioner's statement on FDA's Comprehensive Regenerative Medicine Policy Framework. It's a mouthful. FDA's Comprehensive Policy Framework. It's so amazing. It is the future. They talk about it being the future of medicine, and it's here now, thank goodness. The FDA originally established a regulatory framework for these products that went into effect in 2005. But in the last decade, we've seen improbable advances that hold out great hope for patients. I believe with the ability to facilitate the regeneration of parts of the human body, we're bearing witness to the beginning of a paradigm shift in the practice of medicine. This is the practical promise of modern application of regenerative medicine, FDA, November 2017. Another testimonial. My name is Andrea. I was diagnosed with spinal stenosis in my 50s. It started with numbness in my feet and eventually involved both legs. By 60, my pain level was a continual 7 to 8, and I could hardly walk, lift, or bend. My doctor recommended back surgery, but I selected steroid shots. I went from a walker to a wheelchair as I could no longer walk. After stopping my shots, because of the danger involved with steroids, I was back to a 9 to 10 pain level. I heard about stem cell procedure and spoke with Dr. Trent Ryan of Kennedy Health in Delaware. I was nervous but could relax knowing it was not surgery. Everyone was so kind and caring. My own stem cells were harvested and placed where needed. It turned out that the pain was minimal, and I was able to joke with the doctor as he did the procedure. 1 year later, no wheelchair or walker. My pain is only minimal or occasional, if at all. I feel as if this was a gift from God. We had to do many levels of her spine. I remember her. We had started at L5 and we went all the way up intradiscals, all the way up to all the epidural space, and it took a while. We got all the way up there, but she got up, left in the walker, and we see her walk in later on with a big smile on her face. FDA regulations for clinical use of stem cells, minimally manipulated. The adult stem cells, that's why that bone marrow with the FDA approved devices is the main thing for adult stem cells currently. It works wonderfully. Minimally manipulated can't be changed, can't be grown or cultured. Treatment must be performed on the same day. Stem cells are regulated like a pharmaceutical drug, very strict guidelines. If we're going to use the umbilical tissue, the neonatal, placental tissue, it follows approved, FDA-approved guidelines. The tissue and blood are donated by healthy mothers at the time of scheduled cesarean section. The recovery is performed by American Association of Tissue Bank accredited technicians utilizing aseptic technique. And the lines below this show, hey, look, there are millions of mesenchymal stem cells in the neonatal or umbilical cord tissue that we can utilize. However, we just don't utilize that. We have the ability to use other ones, but sometimes you have to do that. There might be a reason why we're not going to use your own. Here's an eye-opener for a lot of people. A lot of people don't know about this. Many doctors don't know about exosomes. It's a bone marrow donor product that are microvesicles derived from mesenchymal stem cells that are important in the regenerative process. These work in 3 methods: hundreds of growth factors, mRNA, and genetic cell communication. If you remember your biology, you might know a little bit about that. And recruitment of your own stem cells. So it recruits your own stem cells. This is like a smoking gun here. We're able to use these. This is not stem cells, but they will aid your stem cells. Occasionally we'll use this if the very few people, thank goodness the success rate is very high, that the stem cells work. Occasionally, we have one that somebody's not a good regenerator, didn't hurt them, thank goodness. Then we'll use these as a smoking gun and let them go in there and enhance what was given and recruit their own and get the whole thing going. Wonderful new technology. And hopefully this gets to other types of doctors, they'll learn about this. Another testimonial. I suffered with bone on bone with both my knees for the last 7 years. I've had steroid injections, Synthesis shots, water removed from my knees with only short-term relief. I attended a seminar on 9/27/18 and was amazed. The doctor examined me to see if I was qualified as a candidate for stem cell treatment, and I was scheduled for stem cell treatment on Wednesday in Wilmington. I was pain-free after the stem cell therapy and was walking out like a new person. My husband couldn't believe I had it done. I am back to walking 2 flights of stairs in our house. I speak highly of this procedure and the care given at Kennedy Health in Regen America, Delaware. They work with you to accommodate all the treatment you need. They are making amazing history with the new treatments that are using stem cells to regrow. Thank you from the bottom of my heart for a new lease on life. So happy I didn't have knee replacements. What are the cons of this? The old Ben Franklin here, pros and cons. Pros, eliminate pain, greatly improve function, eliminate medication costs, money saved on injections, and money saved on surgery. Quick quiz, I get this question all the time. Which 2 sources on there are coming from you? Which one of the adult sources? Well, hopefully you said bone marrow or fat, the adipose. If you had umbilical cord tissue, you just gave birth and you can't use that, right? So, but we're able to get that from companies that have processed that from the C-sections. This is an MRI sliced this way through L5S1, sliced this way, and you're looking down at it, and you see the disc, L5S1 disc, that's the circle or the oval. You have the spine right behind that, and you see the nerve roots coming out. That arrow is pointing to one of the nerve roots, the white. The one on the other side, that looks good, it's thick, it's going through that area, it's healthy. Where's that going? It's going down your leg, into your back, into your buttock, and it's creating pain down there. The one on the other side is creating the pain. That one's working great. The one on the other side is getting pinched, right? The disc is pushing back. And what are these disc problems? Disc protrusions, disc herniations, slip disc, degenerated disc, arthritic degenerative disc. It's all the same thing, really. Call it something different. It's pushing on the nerve. But also what's behind it? See the other gray area? That's spurs. That's also parts of arthritis. What's this problem called? Stenosis. We see it in people all the time, and if you're over the age of 45, 50, and you have back pain, oftentimes this is one of the main culprits. So how do we treat this? We feel so lucky that we have the best providers doing this, because we can actually take your stem cells or another source, or whatever we need to do, whatever works out best for you, we'll take that and put it right in the disc. See the arrow? Well, we put it right in that disc. And they take it right in the transforaminal space, right along that nerve root. We'll do a transforaminal epidural. Sometimes we'll do an intralaminar epidural. Depends where it is. We'll always do the facet joints, which sit back behind that. They're often arthritic. So we just soak the area. We do it over the top. If it even hints that there is an issue on the films, we'll get it anyways, but it's not going to hurt it. We soak it with millions of mesenchymal stem cells, and you get up and walk off the table and go home. Just like the lady you saw in the testimonial, you can have pain relief within days or weeks, and sometimes bring people out of walkers. That's what we're doing all the time, let alone just getting out of pain. Here's a study that was done on the amniotic work, where that's actually the top end stuff. This was done levels of pain at around a 7 or 8 at week 0, which is when you got the treatment. Week 0 is when you got the treatment, when you received the treatment. Pain levels around 7 or 8. The pain score you see on the far side, pain score. Most people coming at that level. By week 1, down to a 2. By week 5, being out of pain. And this is not even using the live stem cells. This is growth factors mainly. Amazing what the stem cell does. Some athletes that have had this done, there's a ton of athletes. They're all doing this work now. Rafael Nadal had it done. Well, he's still playing, and he's going to continue his career, see some longer careers. Peyton Manning had it done after a surgery. Did pretty well, got him back to win a Super Bowl. And certain spinal surgeries, you can still use stem cells. So if you had spinal surgery, there's a chance we could still help you. We have to analyze you. Another testimonial. I wish I had known about stem cell therapy earlier. Compared to actual knee replacement, this is virtually painless, and I definitely recommend it to others as I am pain-free. Can you imagine life without suffering? Wake up each morning without pain, and how happy your friends and family will be when you get your life back. You don't realize what you look like. Your family sees you every day. I'll sometimes videotape the patients, and I'll show it to them. This is what you look like, and you don't know it. It's one of the reasons why you got to keep getting your driver's license picture taken again. You don't realize what you look like, right? We'll show it to them like, oh, God, you look like Quasimodo. Oh, I thought I looked better than that. And then the wincing you get. You sit down, get up, and the looks that you have on your face. And how many agree with me, it's nearly impossible to be as happy as you can be if you're in pain. It's nearly impossible, isn't it? Be happy. Your family sees you unhappy. Also do it for your family. Get out of pain. Your healing starts with a single decision. The most successful action taken by people who get out of pain is a decision to change. The time is now to see if we can help you. You're worth investing in. Saying no to regenerative medicine is saying yes to more drugs, more steroids, surgery, maybe multiple surgeries, and more recovery drugs. And of course, the death rates of surgery. 2 choices you never had before, one of which you never had before. Say no, think the same, do the same thing, get the same results. Definition of insanity, right? Or say yes. Regenerative stem cells, start your life over again. 4 reasons to do stem cell work now. They only actually work if you get them. You actually got to do it. You can't think about it. We thought about it long enough, how many years you've been in pain, and all the other treatments you've done that aren't working for you. Your best chance of improvement is right now. Things get worse over time. You may not be a candidate. We had to turn away somebody the other day that needed a shoulder done, and we couldn't do it. She was so bad that we had to turn her away. And so degenerated. Sometimes they have to do surgery. Thank goodness a lot of people can do this, but get looked at right away, because if you put this off, you may not be a candidate, and you've got to risk yourself to those dangerous surgeries. Life is about happiness and living. The better you'll feel, the happier you'll be. There's nothing more important than your health, not your car, not your house, not anything. It's no longer necessary to be in pain and unhealthy. And think of how happy your loved ones will be when you feel better. So I'm going to give everyone a gift that's listening to this. It's a free examination. It's worth $250. It's free. The initial exam and x-rays. We'll do any film we need to. They're digital films. Bring in what notes you have. If you have MRI reports or discs or whatever you have, bring in what you have, but don't go crazy trying to find it and I can't get it. And just come in. If you have it, we may not have to redo it, but come in anyways. Like I said, it's worth $250 and it's completely free. What are we going to do during this examination? We're going to examine you. We're going to figure out, number one, are you a candidate? We're going to go through any question you might have, and you're going to have all kinds of questions pop up on this because it's so exciting. Write them down. Come in with them. We'll handle any question you have. We're the experts in this. We have all the data and research. We have everything that you need. Thousands and thousands of areas of research, and it's wonderful stuff. We're also going to go through, how much does this cost? What's the price on this? You might know now, it's not covered by insurance. Will it be? Yeah, down the road. Probably 8 to 10 years out, around that area. Do you realize that even a drug that's FDA approved takes 8 to 10 years to get covered by insurance? Do you realize? A lot of people don't know this. And our clinics are around a lot of pharmaceutical, and they come in, and my patients, oh yeah, my drug got FDA approved, and it took a decade for it to be covered. But you had to pay for that drug to do it beforehand. It'll be covered. Can you wait 8 to 10 years? You're probably not going to be a candidate. You might not be a candidate in 2 months from now, let alone 8 years. You got to get looked at. We'll go through at that consultation how much it's going to cost for you. We'll figure it out. And what's the cost of being in pain? It's going to cost them thousands of dollars. But we'll figure that out for you. We have financing available. Same as CATCH. We work with the best groups with this. We figure out a way for you to get the treatment you need because it's all about you getting out of pain, and that's what we do. So call us at 302-778-0100. We're in North Wilmington, and we'll give you directions and everything. And we're right off Route 202. We do the majority of stem cell work in that tri-state area. Give us a call, and we'll set you up. Mention the webinar when you call, and we'll give you this free consultation. You have nothing to lose with this except your pain. One last thing, make sure you call us. We are Joint Commission accredited in office-based surgery. We're one of the few clinics that can do this work the proper way and get it right into everywhere you need it, not with an ultrasound only or not just with a blind shot. There are clinics that are starting to open up that can only do umbilical cord tissue. You need to go to an accredited source that can do this. They're accredited and have fluoroscopy and C-arm capabilities and doctors trained in interventional pain to do this appropriately. Just in case you didn't know what a fluoroscope or a C-arm is, it's basically a big C-arm, and a fluoroscope is a type of X-ray. But that's how surgery centers, we're accredited, similar to that, and that's how you actually get the medications. We're not using medication, we're actually using stem cells and putting it right where you need to. That is the way you have to do it to get in the spine correctly, and the best way to do joints in other areas because that is the standard. Using fluoroscopy, it costs a lot to have this center and be accredited with this. It costs a lot, but that's why not too many clinics have this. We have it, and we're the best trained in it. It's one of the reasons our results are tremendous. We get it right where you need it instead of missing the spot. It's amazing how it works reasonably well without all that. You got to get the right group. So call our clinic, 302-778-0100, and we're going to get you set up for the free consultation. We'll see you there. Bye-bye.